Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. It's brought to you by the South Carolina Department of Health and Environmental Control. Visit scdhec.gov for an updated list of testing sites and important information on how to protect yourself, your family, and friends from the coronavirus. SCDHEC, healthy people, healthy communities. In it together and the South Carolina Diabetes Advisory Council, presenting Wellness Wednesday every Wednesday on Coping with COVID. The City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Log on to columbiasc.net/OBO. Agape Counseling and Training Services. Call 803-779-2777 for licensed professionals of counselors and social workers helping families, engaged and married couples, and individuals of all ages gain an understanding of all aspects of their lives. If you're having a challenge coping with COVID, contact Agape Counseling and Training Services at agapects.com. And Palmetto Media Connections, connecting media and communities together. Coping with COVID, brought to you by SCDHEC. In it together, the Diabetes Advisory Council, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Center, and Palmetto Media Connections.
Coping with COVID with Trey Taylor.
Happy Thursday, and thank you so much for joining us for Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. I'm Trey Taylor, and today we're going to get our COVID vaccine update with Dr. Jane Kelly. She is the Assistant Epidemiologist for SCDHEC. She's right here, and she's going to join us later to tell us all about the booster shots, the kid booster shots, and she's going to look into her crystal ball and tell us the future of COVID. Dr. Kelly, thank you again so much for joining us today. I appreciate it.
Absolutely. I'm glad to be here. Thank you.
Thank you. Thank you so much. Plus, DSS recently announced additional funding for families who need help paying for daycare. That and more coming up next on Coping with COVID. But first, your COVID community updates. After an investigation lasting over a year, 2 people have been charged for the killing of 7-year-old Knowledge Sims. The Columbia boy was fatally shot after gunfire was blasted into his home last April. 24-year-old Trayvon Wilson was arrested around 6 p.m. yesterday, and 21-year-old Quazez Carter, who is currently incarcerated for an unrelated crime, is also facing charges. And the families of the Emanuel 9 tragedy will share an $88 million settlement from the Justice Department because the killer, Dylan Roof, was able to purchase a gun without a sufficient background check. The largest resolution of a civil rights case in the United States will award $63 million for the families of the deceased and $25 million for the survivors of the shooting. SCDHEC has your most up-to-date list of times, dates, and location for COVID testing in and around South Carolina. Visit scdhec.gov for more information. Now, if you are a veteran, the VA will handle all vaccines for veterans. There are also several retail facilities that are handling COVID vaccinations, Kroger pharmacies. Also, CVS is handling COVID vaccinations. That includes the CVSs located in Target stores. And West Columbia Brooklyn Baptist Church is having a vaccine clinic every single day. You can see the information there. And the library, the public libraries in Richland County are distributing drive-through and curb-through free self-collection kits. You can get 5 per week, and they are available at all Richland County library locations. Now, if you are having some challenges getting to your vaccination site, don't miss your shot. The Comet is offering free rides to get your vaccination. Also, if you are having a challenge making your vaccination appointment, Get Set Up is helping seniors that may be technology challenged with helping them to get set up to make their appointments. Now, Prisma Health is continuing their free flu vaccine drive-through locations. You can see there, they have those locations going on through Saturday. So you can get a free flu shot from Prisma Health. Now, if you lost a loved one due to COVID, FEMA is continuing COVID reimbursements. You can check out the website and the phone number, which is on the screen right now. Call or visit the website for more information. The SC Bar Association and SC Legal Services have a toll-free number and website for rental and mortgage help. Several other rental assistance programs, including rental assistance from Richland County. Lexington County also has a bill assistance program. Dominion Energy and SC Housing have collaborated for a rent and utilities assistance program. Also, bill assistance resources, again, from Richland County, SC Housing. Several resources are available. You can see that information on the screen. Additionally, SC Housing has a frontline workers home buying program for those folks who are on the front lines. And if you or someone you know is having a challenge coping with COVID, the South Carolina Department of Mental Health has launched SC Hopes. It's a toll-free number that's available 24 hours a day, 7 days a week, if you need some resources coping with COVID. It's election time in Columbia, South Carolina. Election day is November 2nd. Early and absentee voting is going on now. You can actually look at the information on the screen and make sure you vote early and just go over there and vote. That information is on the screen as far as the early voting and absentee voting. And you don't have to have a excuse or reason for absentee voting. You can just go over there and tell them that you do want to absentee vote. I'm Trey Taylor, and you're watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. Now, we are streaming live on the Tailor Made Production Facebook page. Please go over there and hit like and share and follow so that you can get a notification as to when you can check out Coping with COVID Monday, Wednesday, Thursday, and Friday at 2 p.m. And then first Monday with George Wallace with a Fun Day Monday. And then, of course, on Wednesday, In It Together SC and the Diabetes Advisory Council of South Carolina present Wellness Wednesday. We're also streaming live on YouTube. I want to thank all of you YouTubers for checking us out. And please ask you to hit the subscribe button. We also have a presence on Instagram and also on Facebook. Hey, now don't forget to post and share this information out so we can get the message to the masses, because we are sharing not only some critical information, some important information that people want and need to hear. We are talking to Dr. Jane Kelly. She is assistant epidemiologist with SCDHEC, and she joins us today to give us a vaccine update. Dr. Kelly, thank you so much for joining us. I appreciate it.
Oh, well, thank you so much for inviting me.
Absolutely. So listen, the last time you were here, we were able to see your beautiful home and your dog in the background. And now you have set up a whole studio in there. You're a television star now.
Trying to look a little more professional.
Well, you did good. You done good, Dr. Kelly. Listen, let's get to the vaccine conversation. Now, the latest thing in the news is that the kids' vaccine has been approved and is getting ready for rollout. As a matter of fact, I did a story yesterday that DHEC's health departments across the state are actually closed Wednesday, Thursday, and Friday to get folks trained to give the kids vaccine. Can you give us some more information, updates, and timeline on the children's vaccine?
Sure. So the Food and Drug Administration has issued their emergency use authorization for a vaccine, a Pfizer vaccine specifically for ages 5 through 11. And they presented a lot of very reassuring data on safety as well as on effectiveness. The next step, though, in the process is CDC also does a review, the Advisory Committee on Immunization Practices. So we're waiting to hear their recommendations as well. We fully anticipate that they will agree with FDA's findings that the vaccine should go forward, but they might have some little recommendations, more nuanced recommendations. For example, if a child had prior COVID, should they get a single dose or 2 doses of vaccine? And that sort of thing, I think that they will address. What do we know? What science do we know about those doses of vaccine for kids? But we do anticipate that they will approve it as well. And they meet on November 2nd and 3rd. So what we're doing in the meanwhile is trying to get everything in place. So as soon as they give the green light, we can go ahead and start vaccinating, maybe as early as November 4th.
Well, I tell you, my 5-year-old school has already sent an email saying they're taking appointments for the
Yes.
for the kids' COVID vaccine. Now, they also sent out they sent that last week, and then I got a notification this week that it wouldn't be ready by, I think, the 3rd or the 4th. They're pushing it back a week. So, like I said, DHEC is already getting, their staff ready, and schools are already rolling out this, COVID vaccination for kids, the clinics.
And that is good news. I mean, in addition to the about 1,000 vaccine providers that we have around the state who've been giving vaccinations for ages 12 and up, we've added several hundred pediatricians. So many parents will be able to get their kids vaccinated at a familiar place. So they'll be able to go to their own private pediatrician, plus all the DHEC clinics. And so what we are doing meanwhile is getting vaccine out there, because it is a different dose of vaccine. So making sure that we have the training so everyone knows how to mix up the vaccine, appropriately.
Right.
But also for people who have been spending, the past almost a year vaccinating adults and adolescents, we want to make sure that they feel comfortable working with children as young as 5, because giving a vaccine, reassuring a child, reassuring nervous parents is a little bit different. So that training will also include that sort of behavioral context.
That's so important, and that's so good to hear, because you're right. You're dealing with a different animal when you're talking about a child. And like you said, as a child as young as 5, you've got to be, like you said, a little gentler, a little bit more empathetic. So I'm so glad to hear the training is including not just how to give a shot and to make sure it's the right shot, but also the emotional and the sensitivity involved with giving a child a shot.
Absolutely. And working with young parents who are even more anxious about giving their child a shot than taking the shot themselves.
Yeah. We're talking to Dr. Jane Kelly. She is assistant epidemiologist with South Carolina Department of Health and Environmental Control. And we're talking about the kids' vaccine. So I did read that the vaccine is housed or labeled differently than the other vaccines, so it can be clearly seen that this is the kids' vaccine. That's amazing.
Yes, absolutely. It's got a different color cap on the bottle. It's still the Pfizer vaccine, but at a different dose. The normal Pfizer dose is 30 micrograms. This one for kids ages 5 to 11 is going to be 10 micrograms. So It's a smaller dose. That way that it will try and minimize any symptoms that they might have after being vaccinated. And in the pilot studies, they found that found what was expected, that many kids did have some mild symptoms, sore arm, feeling achy all over. In fact, the kids ages 5 to 11 had less in the way of fever and chills than adolescents and adults, which is kind of interesting. And there were no serious adverse events. There were no serious allergic reactions or other serious events. So the vaccine has demonstrated itself to be safe and effective in kids that age.
Yeah, I'm glad you mentioned symptoms, because I was going to ask about what are some of the symptoms. Are they similar to the ones in adults? And
they are similar. The main one is, pain at the site of the vaccine. And that makes sense. It's just irritation. It's a sign that your immune system is responding. That's been the main one. Other common symptoms have been headache, feeling achy all over, muscle joint achiness and some fatigue. But most of the time, these were mild symptoms, and they went away after just 1 or 2 days. And it is treatable with Tylenol, with acetaminophen.
Tell us a little bit about how the children's vaccine was tested, Dr. Kelly, on who, how many, how long. What was that process like?
Normally when there is a vaccine development, they look at vaccines for children right from the beginning. But for COVID-19, it was different. The most serious cases of COVID-19 and the group with the highest number of deaths were older adults. So vaccine rollout really was focused on adults. But we've been doing this in steps, right? First, there was vaccine for adults, and now Pfizer is fully approved for adults. And then there was vaccine for the adolescents, age 12 through 17. The testing that was done in adolescents 12 through 17 really was finding the same thing as what we found in the adults in terms of vaccine safety, in terms of vaccine effectiveness. When you're starting to talk smaller kids than that, younger kids than that, it's not just a weight difference. It is also a different level of maturity of their immune system. So the approach is similar in that you have a group of children who get the placebo, they get a fake shot of saline versus the children who get the vaccine. And they tried different doses of vaccine, different schedules to see what's going to be most effective. But in the phase 2-3 studies, those are, the last set of studies, they're measuring antibody levels, but they're not just looking at the blood and antibody levels. They're also looking at real world effectiveness, meaning of those kids who got placebo and kids who got vaccine, how many of them developed COVID? So we're talking over 2,000 children in these phase 2-3 studies. Then what they found is that 16 kids who had placebo developed COVID-19 serious enough that they ended up in the hospital. And 3 kids who had gotten the vaccine ended up in the hospital, but none of them in the intensive care unit. So nothing in life is 100%. The highest idea behind vaccine is to prevent you from developing severe disease. And that study definitively showed it. When we're talking 3 kids who, yes, were sick enough, they put them in the hospital, but they did not need intensive care unit support. They did not need to be on a ventilator or any of the more sophisticated things. Whereas the kids with placebo who didn't get the vaccine, a substantial number of them did end up in the hospital. I know in that age group, people think, oh, kids don't get seriously ill. And fortunately, that is largely true. Kids age 5 through 11, they are resilient. Most of them don't get severely ill. But, in the past year, almost 2 million kids that age group have tested positive. Over 8,000 have ended up hospitalized. And 94 of them have died. 94 kids ages 5 through 11 have died of COVID-19 in the United States. And I know that doesn't sound like much, but that made it the 6th leading cause of death in the past year. In that age group.
In just a year. A year.
Yeah. So I know that I understand people thinking, oh, it's rare for kids to get severely ill. Well, I wouldn't call it rare. 94 deaths that were preventable by vaccine. We want to bring that down to 0 deaths.
Yeah. We're talking to Dr. Jane Kelly. She is assistant epidemiologist with SCDHEC. I'm Trey Taylor, and you're watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. Listen, don't forget at the bottom of the screen, you will see scrolling all types of resources that are available not only in South Carolina, but throughout the country. If you need information on how to get financial assistance due to COVID, childcare assistance, also where vaccination locations are, and other resources are available. We share them here on this show. And again, that information is scrolling at the bottom of the screen. We're talking about the booster shot. We're getting an update now on kids. You said it was the Pfizer vaccine. So that's what is available right now. And the only thing that has been approved, the Pfizer for kids.
And it's not quite available just yet. I mean, it's pre-positioned. It's in the pharmacies right now waiting, but we need to wait for that final word from CDC. But we anticipate it might be available as early as November 4th.
Right. Vanessa Dunn-Guyton wants to know, Dr. Kelly, is it safe for children that have diseases like epilepsy, diabetes, or cancer, et cetera? Thank you, Vanessa.
In fact, it is so important that specifically those kids who have chronic medical problems like epilepsy, diabetes, cancer, they do not have as robust an immune response sometimes if they're on cancer medication. So it's all the more important that they specifically get vaccinated. They're more at risk for developing severe disease. So yes, it is safe, and it's important that children with chronic medical problems get vaccinated as soon as they can.
Wow. Thank you, Vanessa, so much for your question. Please continue to post and share this information out. This is such important information, such needed information that lots of people need and want to have because, as you say, Dr. Kelly, it is getting ready to become available, this children's vaccine. So it's a Pfizer vaccine. Will kids need 2 doses also?
Right now, kids will need 2 doses also, and it's the same dosing schedule as we had for adults and adolescents, with you get your single dose of vaccine and then wait 3 weeks, so 21 days to receive the second dose of vaccine. There's a little wiggle room in there. It doesn't have to be exactly 21 days, but it should not be any earlier than 17 days. You need to have space out those vaccines to get the best effect from them.
Mm-hmm. Now, will kids need a booster shot?
That we don't know yet. Kids have remarkably strong immune responses to vaccines, so it's possible that they will not need a booster shot, but that's going to take some time before we know that for sure. You know, there are lots of other vaccines where we give boosters. Think about all those pediatric vaccines like the diphtheria, tetanus, and pertussis. You know, you give that at 2, 4, and 6 months, and then you get a booster at 12 months, get another booster age 4 to 6 years. You know, so it may be that kids will need a booster, but we don't know that yet.
Right. Now that we're talking about boosters, can we talk about the adult booster shots? I think there's still a little confusion as to who should get a booster and when.
Sure. So I think some of the confusion is because vaccine became available as a third shot for people who were immunocompromised.
Right.
So let's talk about that first, because that started in August when scientists realized, looking at antibody studies and who was getting hospitalized with COVID-19, people who were immunocompromised. And by that, I mean people who have cancer, active cancer, they're on chemotherapy or receiving radiation therapy. People who had an organ transplant, who maybe like a kidney transplant, who are on medication to prevent them from rejecting that transplant, or even people on high dose steroids like prednisone, 20 milligrams or more a day. Those folks need a third dose of vaccine because their immune system is weakened. And so those first 2 doses, they didn't get as big a response as somebody else might have. So it's recommended that they get a third shot as part of their primary series. That 2 isn't enough, get a third one. And you could get that third one as early as just 1 month after your second shot.
Oh, wow.
So, but that's a small group of people. That's maybe 3% of adults in the United States are in that situation.
Well,
Now,
I was just going to ask, for that group of people, do you suggest just, if I know I'm immune compromised, let me go ahead and get my booster? Or do you think they should get a referral, so to speak, or suggestion from their physician?
So if you are immunocompromised, then you can just go to the pharmacy and get your third dose. You don't need to wait for 6 months after your second dose. This is a different situation. You want to get your third dose as soon as you can, as long as it's spaced out 1 month since your last dose of vaccine. And this is true for people who got Moderna or Pfizer. They both can get a third dose of vaccine. Now, what if you got the Janssen vaccine? That was the single shot. They've now found that the Janssen vaccine is a good vaccine, but it works better as a 2-shot administration. So if you got, and it was developed to be a single shot, and it does do a good job in keeping you out of the hospital, and preventing severe disease, but it does an even better job if you get 2 doses of vaccine. And I think it's taken some time for them to really come up with the data to demonstrate that. But if you get 2 doses, it brings you right up on par with Moderna and Pfizer in terms of effectiveness in preventing severe disease. If you got the Janssen, just to be clear, this is true for everybody who got Janssen. So even, young, healthy person, you got Janssen vaccine, you should get a second shot. Your second shot could be of Janssen or of Moderna or of Pfizer. Just get a second shot.
Right. So again, you're saying something that's very important. And I was going to ask about the mixing and matching next. So you're saying now the 1-shot Janssen, now, if you've gotten that, you need to go back and get a second shot. And you're saying you can get a shot of anything.
That's right.
Except for a shot of tequila. You can get a shot.
That's right. And, it's not that the Janssen vaccine is not a good vaccine. It is. We were hoping it would be a single shot vaccine. But, we don't have very many vaccines that are a single shot. Most vaccines need at least a second dose. And so the Janssen does as well.
So Dr. Kelly, and it's okay, again, to mix and match. If you got the Janssen, you can get a second shot of Moderna or a second shot of Pfizer?
Yes. Now, this is what's special about Janssen. So you can get a second dose of Janssen, or you can make your second dose Pfizer or Moderna.
And not only will you be okay, you will still be fully vaccinated.
Yes. Yes. Who is considered fully vaccinated? You don't have to get a booster to be considered fully vaccinated in terms of travel or your employer. Even with just the single shot of Janssen, you are considered fully vaccinated. But we are recommending that you can make your immunity even stronger by getting a second dose. And which vaccine to get, that's personal choice. Any of them is good as a second dose.
Wow. Okay. Are you supposed to take your vaccination card with you to get your second or third dose?
It's very helpful if you do, because that way they can write on the same card. So you're not walking around with two different cards. So it's very helpful if you can bring your card with you. And what I did as soon as I got my first dose of my card, written on my card, I took a picture of it so that if I lost the card, we could always, reproduce it easily.
Yeah. We're talking to Dr. Jane Kelly. She is assistant epidemiologist with SCDHEC. I'm Trey Taylor. You're watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. Hey, don't forget to post and share this information out so we can get the message to the masses. We're talking about the COVID booster shot. If you're just joining us, you want to hit the replay button because we were just talking about the kids booster shot. If you have children or no children, you want to get that information. We're talking now about the adult booster. Who needs it? And Dr. Kelly just dropped some major tea that you can mix and match. If you got the Janssen, first of all, if you got the Janssen, the one shot, you need to go get in line and get another shot, because now it's been found that you will get better effectiveness if you get another shot. Interestingly enough, you can get a shot of anything vaccine-wise, Moderna, Pfizer. And if you are getting the booster after having a Pfizer or Moderna, you can also get a second shot, your third shot, a booster shot of either one, regardless of which one you got. Correct, Dr. Kelly?
So let's do an instant recap
with
a couple of different categories. Immunocompromised, you want to stick with the same vaccine. The reason if you're immunocompromised, you need a third shot is because the first two didn't take as well as they would in somebody with a normal immune system. So stick with the same thing for your third shot. That third one comes at least 1 month after your second one. That's for a small group of people, though. That's a special group, immunocompromised. They're under a doctor's care. They can talk to their healthcare provider to understand better. Another relatively small group are the 15 million people in the United States who got the Janssen vaccine.
That's a small group. 15
that is a small, relatively small group,
right,
compared to over 200 million people in the United States who've been vaccinated. About 15 million of them got Janssen. What do they need to do? Well, they could just stick with their single dose. Their single dose, they are considered fully vaccinated. But studies have shown that you can get even better immunity if you get a second dose. And that's not surprising. That's true for lots of other vaccines as well. So the recommendation is you could just stay with your one dose of Janssen, or if you wanted to strengthen that immunity, get a second dose of either Janssen or Pfizer or Moderna. They've tested this to see whether you can do that sort of mix and match with the Janssen vaccine, and you can. Now we're going to move into talking about boosters, though.
The booster shot.
And by booster shot, I mean something a little different than those other two. I mean a booster 6 months after your initial 1-2 shot.
Mm-hmm.
The reason for a booster is your immune system sometimes needs a reminder. Your immune system is busy. Every day you are dealing with other bacteria, viruses, fungus, mold. Your immune system is fighting all of these things. So if you got Pfizer or Moderna, you got 2 doses of vaccine, and that sets up your immune system to respond, make antibodies, make memory cells, get that good response going. But for some groups of people, maybe not everyone, a booster is really needed as a reminder to your immune system. Pay attention now to this COVID. Pay attention. Who does that need? Who is in that group? Who should get a booster 6 months later? Well, definitely people age 65 and older. Even if you are a healthy 65-year-old, no medical problems, with age, your immune system slows down, doesn't respond as well. It is definitely recommended people age 65 and over get a booster shot of your with your Pfizer vaccine. Get a booster shot. If you are age 50 to 64, but you have medical problems, maybe you have diabetes or heart or lung disease, or maybe even just being overweight or obese, those are all risk factors for more severe illness if you get COVID-19. So booster shot is recommended for that group of people.
All right.
Another group would be people who live in long-term care facilities. You know, a lot of those are older people who are in nursing homes, and they're already in one of those categories I just mentioned, but also sometimes younger people who are in, you know, developmental homes, or or people in incarceration settings. You know, they can't really physically distance. They can't protect themselves as well. So those are three groups that definitely should get a booster shot. Now, what about everybody else? Well, then it depends. It's much more of an individual decision. So say, for example, you're between the ages of 18 and 49, but you have medical problems. And maybe those medical problems are not in great control. Should you get a booster? That's an individual decision. You may get a booster. You can get your booster, but it's a sort of thing that we suggest talk to your doctor, talk to your pharmacist, you know, take into considerations what is your personal benefit. And another group would be people who don't have medical problems, who are younger than age 50, but maybe they work in a setting where they're exposed to COVID a lot. Maybe a nurse or someone else in a healthcare setting, or maybe a grocery store worker who's, you know, front-facing, interacting with the public every day. Right. They may want to get a booster also, just because they know they're exposed so frequently. They don't. It's not recommended that they should, but rather that they may get a booster if they want.
Right, right. Dr. Jane Kelly is the assistant epidemiologist with SCDHEC, dropping some great knowledge about the COVID vaccine for kids, the booster, the mixing and matching. Before you go, I want to ask, what's the state of South Carolina, state of COVID in South Carolina, Dr. Kelly, including the variants?
Fortunately, right now, we have had a downward trend that's been continuing for several weeks, and that is very good news.
That's
because
great.
Back in August and early September, we were having more than 5,000 new cases a day.
Wow.
And now we're consistently under 1,000 cases a
That's
day.
great.
Now, that's still a lot. So we're still concerned about this and hoping that this trend continues with bringing the number of cases down. And the best way we could do that would be with vaccinating more people. Right now, South Carolina is sitting at about 55% fully vaccinated for people age 12 and up. It's going to be really important that we get those kids ages 5 through 11 vaccinated as well when vaccine becomes available to them, because vaccine is our way out of this. I do have some concern about holidays coming up. People will be traveling. People will be getting together with non-household members. You know, if people are vaccinated, that's much safer. But I do have concern that there'll be people getting together who are not vaccinated and may spread virus from one person to another inadvertently by accident.
Right.
And especially spreading that virus to people who are the most vulnerable, the older adults or people with medical problems. That does worry me.
Yeah. And finally, what's the future of COVID? Listen, every time I ask, I mean, the answer is fluid. I know, because it continues to change. And, I said in the opening, you're going to pull out your crystal ball and tell us what the future is. But what do you think it is? I mean, listen, like I said, last year, this time, we didn't probably think we'd be, going into the next year with it. And now we are getting ready to end the year in just a couple of weeks, a couple of months. So what is the future of COVID?
Funny you should mention crystal ball, because my husband listens to these podcasts or interviews, and he heard me say enough times that I can't say I don't have a crystal ball, that he actually bought me a crystal ball.
Look at you, girl.
I'll tell you, I look into this crystal ball and it's still a little hazy.
I was going to ask, now that you got your crystal ball, can you tell us what the future of COVID is?
Well, I can say a few things. Right now in South Carolina, 99% of the new cases that we are seeing are all of the Delta variant. What's important to know about the Delta variant is that it spreads more easily. That's why it has really whipped through South Carolina. But the good news is the vaccines are effective against the Delta variant. So, people getting vaccinated right now, that will help to keep them out of the hospital, out of the morgue. The vaccines we have available are effective against the Delta variant. The concern we have, though, is until we get more people vaccinated, another variant may come along and start to replace Delta. And, we may be back to the starting gate again.
Wow.
I'm not as concerned about the new variant coming anytime soon. I think Delta is still going very strong. I'm just concerned that we have a lot of people out there who are still vulnerable, who are unvaccinated, including people who say, well, I had COVID, so I've got natural immunity. It's true. If you had COVID infection, you have some natural immunity. But think about this. What if you had COVID, but it was a different variant?
Wow,
what if you had COVID and it was, the original variant? You are not as protected against the Delta variant. You may get reinfected. Whereas the vaccine is specifically engineered. They specifically tailor-made this so that it would work against these variants.
Wow. All right. Well, Dr. Jane Kelly, Assistant Epidemiologist with SCDHEC, thank you so much for joining us. Thank you so much for giving us all of this great information. Daniel Lake, thank you for commenting. She says, thank you, Dr. Kelly, for very helpful information. Mitchell Peace Joy Jen said, thanks for the information. Thank you, ladies, for watching. Thank you for commenting. And please, everyone, post and share because we need to continue to be updated about what's happening with COVID. And not only do we need to know, we need to spread credible information about what's going on. Dr. Jane Kelly, thank you again so much for joining us today on Coping with COVID and providing us with this COVID vaccine update. We appreciate you.
My pleasure. Thank you so much for getting the word out.
Absolutely. Absolutely. Coming up next, if you are a parent or have care of children, then South Carolina families are getting help from DSS. Whether you need kids in daycare or whether you have a child care facility or whether or not you already are in the SC voucher program. Coming up next, my conversation with Conley Ann Ragley of SCDHEC. That's coming up next on Coping with COVID. I'm Trey Taylor.
Computers, they're a part of our everyday life. But when they're not working, they're an everyday problem. So call Computers Unique, your everyday solution. 803-351-5821. Is your computer running slow? Won't turn on? Do you need a screen replaced? Or maybe you just need another computer? Well, Computers Unique is your one-stop shop for all your computer needs. They have a wide variety of new and pre-owned PCs, Macs, and tablets. So call Computers Unique, Dutch Square Mall. 803-351-5821. 803-351-5821.
Let Palmetto Painting Services take the worry out of your next home painting project. We can paint anything. Our business is about interior painting and exterior painting. We offer services for residential and commercial properties. Restore the life to your home with a fresh coat of paint from Palmetto Painting Services. References are available upon request. Give us a call at 803-546-4570 today.
The Comet gives me a reliable source of transportation.
It's very convenient to me, and they have wonderful drivers.
It's clean, and it builds community. It's fun to meet people.
It makes me feel like really independent. It's just fun.
It's always going to be there, and it gets me everywhere I need to go.
We try to ride every single day. Comedy is our livelihood.
Imagine yourself 1 year from now. You've tackled your prediabetes, you're eating well, staying active, and reducing stress. You've even made a few new friends, all because you took charge of your health and lowered your risk of type 2 diabetes. It's possible when you join In It Together SC. You can start by taking our online risk assessment. Find a coach to help you with real-life solutions. This can be you, and it can all start today. Find an online or in-person program. Visit inittogethersc.org to get a healthier head start on your future. Brought to you by the Diabetes Advisory Council of South Carolina.
Thank you so much for joining us on Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. We are streaming live on the Tailor Made production page. Please go over there, hit like and follow and share so you can get notifications when we go on the air, which is Wednesday, Thursday, and Friday at 2 p.m. And also First Monday with George Wallace. On Wednesday, we do Wellness Wednesday with SCDHEC In It Together and the Diabetes Action Council. We're also streaming live on YouTube. Thank you so much for joining us there. Please hit the subscribe button and please like and follow us on Instagram. Continue to post and share this information out so we can get the message to the masses. And if you are joining us on the replay, thank you so much. Put replay in the comments, and hopefully you are replaying and rewinding and getting that great information from Dr. Jane Kelly about the COVID vaccine. She updated us on the vaccine for adults, who needs to get the booster, the mixing and matching, that was major information, and also the COVID vaccine for children. Right now, though, if you are in need of financial childcare assistance due to COVID affecting your employment, listen up. DSS has implemented 2 new programs to help both childcare providers and families if you are on SC voucher and if you are not. Conley Ann Ragley joins us with the Department of Social Services. Conley Ann, thank you so much for joining us today to tell us about this exciting new information from DSS. How are you doing, first of all?
Hi, Trey. Thanks for having me back on. Always good to be with your viewers and listeners, talking about all things going on at the Department of Social Services. And today we're talking specifically about childcare. And we know that, this has been an issue long before COVID started.
Yes.
It'll be an issue long after COVID is hopefully gone, knock on wood. But one of the things that the Department of Social Services is doing as part of a multi-tiered approach to help both childcare providers and parents that rely on childcare is a big announcement that we made last week, and that is making childcare more affordable for working families in South Carolina.
Yeah. Now, to break it down, this payment goes directly to the childcare facility. So, for instance, if there is a family that is on ABC voucher, because that's the other thing, you've got to be on ABC voucher, but the voucher doesn't cover all of the childcare costs, you're paying out of pocket, this helps that family.
Absolutely. So what we announced beginning October 1st for a provider that is enrolled in our ABC quality program, I know we'll talk a little bit about that later, that the voucher rate for that child attending that center, DSS is increasing that rate that's paid. And so one of the examples that we were given is, previously the maximum weekly payment for a child in full-time care in an urban center that was in between the ages of 0 and 2 for a level A+ ABC quality provider was previously $205 a week. Under this new maximum payment structure that the department has launched using federal dollars from our CCDF funding source, now a maximum payment for a full-time child under the age of 1 year old is $296 per week. So you can see that is a huge bump for providers and parents. And some parents may have had to cover that cost out of pocket previously. So this is a huge benefit. For ages, that same scenario, if the child is an age between 1 and 2 years old, that benefit increases from $205 to $284. And so it's very key that you mentioned here that these monies are paid directly to the provider. And you may ask, well, how does one get involved in the voucher program? How do you apply for it? So we have two programs in South Carolina. One is our traditional SC voucher program that you mentioned, and that is for low-income families, and we have all that information on our website at scchildcare.org.
Okay.
If you receive Medicaid, there's a good chance that you're going to also qualify for this type of child care. And then we also launched a brand new program in October of 2020. So we're right here at the 1 year mark, and we call it our COVID 300. And this is important because this is for working parents who are working at least 15 hours a week or going to school. Maybe you're going back to school to learn a new trade or to learn a new skill, or maybe get into a new career, and your family is at the 300% of poverty level or below. So really this opens it up to a larger population to participate than our traditional SC voucher program. So we have all of that information, and I know you're going to share it for your viewers and listeners. That's going to be on our microsite dedicated just to everything childcare at scchildcare.org. I would encourage anybody who may need help paying for childcare to see if they qualify for one of these two voucher programs.
Yeah, so scchildcare.org. Let's go over that quickly. So there's a regular voucher program for someone who and let's qualify this. Would the person be on Medicaid or the children be on Medicaid? Because
the children would be on Medicaid. That's correct.
Okay, great. And so that's the regular voucher program. Definitely, if you qualify, apply for that. Then there is the COVID 300 plan for those folks who, like you said, may not qualify for the regular program, but because they have been affected by COVID, they can qualify for that. So there are two opportunities here for people to get needed and wanted child care for their children.
That's right. And, one of the questions we get is, well, let's say I qualify for a voucher. Well, then how do I find a spot? So we have two additional resources that your viewers, I'm sure, are familiar with. As we mentioned on scchildcare.org, is we have a brand new search function where you can search by your zip code. You can look and see, for example, let's say you live in 29201. You want to see all of the childcare providers around you, maybe in a 15-mile radius. You can type in your zip code and it brings up a list. And you can also see things such as their operating hours, their contact information, if they participate in ABC Quality. It's very important to remember that in order to receive a voucher, you must attend an ABC Quality participating provider. So if the Child Care Center doesn't participate in ABC Quality, unfortunately, they will not accept the voucher. So that's really key. We're having centers that are reaching out to us about how they can become involved in the ABC Quality program. But that tool on scchildcare.org will help you look by city name. You could also search by type of provider. Let's say you want a faith-based entity to be served by. You can search by keywords like Baptist or Presbyterian or AME. You can search some of those keywords in addition to zip codes. And then South Carolina is also blessed with the South Carolina Child Care Resource and Referral Network that's operated by the University of South Carolina. And they can help help you find a child care center that's really right for you and your needs. Maybe you work a swing shift and you need maybe child care from 10 a.m. to 8 p.m. So they can help connect you to some of those needs. But those are just two ways to help find childcare in your area, as well as being able to look in word of mouth or on Facebook. We've got rankings. People rate things on Facebook. So there's really a variety of ways to try to help find childcare, two of which the Department of Social Services is integrally involved in.
Okay, so the first site, we're looking at it now, scchildcare.org. As you said, you can come right here, search for childcare providers, put in the facility name, put in the zip code. It also has help for parents, help for providers. And again, if people want to participate and need to find a childcare facility, this is there. And if there's a childcare facility that wants to be part of the ABC Child Care, they can also come here and get resources. Now, what was the other way, the USC, the USC site?
Yes, well, we'll make sure we send that link to you, but it's the
Please.
South Carolina Child Care Resource and Referral Network. And
Okay.
that is a great tool where they can help you find a center that meets your needs based on the age of your child, also the hours that you need care. And they can really help, kind of connect the dots so that you can find a provider that's close by to you.
All right. That's the South Carolina Child Care Resource and Referral Network. And then, of course, scchildcare.org. Again, if you need help, financial help with child care providers and services, again, Conley Ann gave us some great information. One, you can get under the regular voucher program. Two, you can participate in COVID 300 program. And for both of those, the provider is able to pay through a grant through DSS and the federal grant, able to pay more than was being paid before as of October. Now, child care providers should already have told parents about this, correct, Conley Ann?
So I would hope so, because those went into effect on October 1st. We really, we know, I turned on the national news last week and there was a huge article and piece on the CBS Morning News about just the childcare industry. And we know that providers are struggling. But here in South Carolina, it's important to realize that we are we're just part of the framework, and these providers that we're talking about here, they are private businesses in that we regulate them for health and safety, but they make their own business decisions. And just like if a provider chooses to participate in ABC Quality, they also need to reach out to us at the agency to apply for this rate increase, because that's something that we have to hear from the provider, that they want to be eligible for this rate increase. And one other thing I'll leave you with is, this is just a multi things like waiving the fees for fingerprinting and background checks. That's something that we're doing. And since March of 2020, the agency, meaning DSS, has pushed out over $180 million directly in the bank accounts of providers to help them, just stay afloat, to help them with things like payroll and utilities and just supporting their employees, as well as sanitation costs and the rising costs of food. So I think as we look forward in response to COVID-19, we've done some things. We'll have some additional announcements that will be coming in the future, but we're all trying to work together to help these providers.
All right, great. scchildcare.org is the site. We're looking at it right here to the right of your screen. If you want more information about finding a child care provider, if you want information about participating in the ABC child care program, if you are a daycare or preschool owner, and also if you need the assistance from SC Childcare for DSS for vouchers for your children, whether you are under the regular voucher program or want to participate in the COVID 300 program, at least go on the site and see if you qualify. You just never know. You need the help, and help has been provided and is provided through SC Childcare by DSS. Conley Ann, thank you so much for joining us today. I appreciate, as you said, all of the information and all of the resources DSS is providing for parents of small children and also for child care providers. Thank you so much.
All right. Thank you, Trey.
Absolutely. All right. What a great information, great resources from DSS. Conley Ann Ragley, again, two great resources there. You can go to scchildcare.org or South Carolina Childcare Resource and Referral Network. And it really doesn't have as much to do with your income if you have been affected by COVID and you need some financial assistance with childcare. Please check out one of those two websites. Listen, if you have a story or initiative that could help someone cope with COVID, we would love for you to be a guest. Please go to booking at copingwithtreytaylor.com. That's right, booking at copingwithtreytaylor.com. If you have a product or service that could help someone cope with COVID, please email copingwithtreytaylor@gmail.com. And we would love for you to be a proud sponsor, just like SCDHEC, the City of Columbia Office of Business Opportunities. Also, the Comet Bus System is also a proud sponsor. And Palmetto Media Connections, Agape Counseling and Training Center, Palmetto Painting Services, the Fifth Circuit Solicitor's Office, Attorney Byron Gibson, and also the Diabetes Action Council of South Carolina. We would love for you to be a proud sponsor. Not to mention Computers Unique, Jet Square Mall. Now, tomorrow we've got another great show. We are going to talk with author Charles Brown. He has a fascinating book about COVID and the spiritual implications, Scapegoat to Lambs, plus more domestic violence abuse awareness coverage with Dr. Sonia Lewis. That and more coming up tomorrow on Coping with COVID. As always, I leave you with a spiritual reading. Here's your Jesus Calling for today, Thursday, October 28th. Jesus says, don't expect to be treated fairly in this life. People will say and do hurtful things to you, things that you don't even deserve. When someone mistreats you, try to view it as an opportunity to grow in grace. See how quickly you can forgive the one who last wounded you. Don't be concerned about setting the record straight. Instead of obsessing about other people's opinions of you, keep your focus on me, Jesus says. Ultimately, it is my view of you that counts. As you concentrate on relating to me, remember that I have clothed you in my righteousness and my holiness. I see you attired in these radiant garments, which I brought for you with my blood. This also is not fair. It's a pure gift. When others treat you unfairly, remember that my ways with you are better than fair. My ways are peace and love, which I have poured into your heart by my Spirit. That's your Jesus Calling for Thursday, October 28th. I'm Trey Taylor. Thank you again so much for joining us on Coping with COVID. Until the next time, I wish you peace and abundant blessings. I pray that you are safe, you get your vaccine, and that you also wear your mask over your nose and under your chin. Thank you guys so much for joining us.
Coping with COVID. Updates on the pandemic and information to help you thrive and survive COVID-19. It's brought to you by SCDHEC. Visit scdhec.gov for an updated list of testing and vaccination sites and info to help protect yourself, your family, and friends from the coronavirus. SCDHEC. Healthy people, healthy communities. In it together, SC and the South Carolina Diabetes Advisory Council, presenting Wellness Wednesday every Wednesday on Coping with COVID. The City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Visit columbiasc.net/OBO. Agape Counseling and Training Services. Call 803-779-2777 for licensed professionals of counselors and social workers helping families, engaged and married couples, and individuals of all ages gain an understanding of all aspects of their lives. If you're having a challenge coping with COVID, visit Agape Counseling and Training Services at agapects.com. The Comet Bus System, a fast, fun, friendly transit system that can take you anywhere you want to go in the Midlands. So don't miss your shot. Catch the Comet and get a free ride to get your COVID vaccine. Visit catchthecomet.gov. Javis Tax Services, South Carolina's premier full-service financial provider with over 20 years of experience. Palmetto Media Connections, connecting media and communities together. And Computer Computers Unique, Dutch Square Mall. Call Daniel for honest, professional, reliable, and knowledgeable computer sales and service. Coping with COVID from SCDHEC. In it together. The South Carolina Diabetes Advisory Council. The City of Columbia Office of Business Opportunities. Agape Counseling and Training Services. The Comet Bus System. Palmetto Media Connections. Javis Financial Services. And Computers Unique.
Coping with COVID with Trey Taylor.